What's up, guys? John here. Titan Talk Tuesday coming at you. And man, it has been a great week so far. It's only been 2 days in a week, but man, in my days, they're busy. So it's been a crazy weekend too. We had 2 events that went on this weekend. So let's cover why everybody joins in. What up, DC Baker, Cortez? How you doing? Glad Pro. Everybody out there in Facebook land, Instagram land. Before we start, please share this if you're on Facebook. Just press that little share button. You can share it to groups. You can share it to friends' pages. You can share it to your page. So please share it. If you're on Instagram, please tag at and name through your friends. I appreciate it. What up, guys? So today we got a great show. I'm going to talk about some of the things that happened over this weekend, some of the events. I'm going to talk about our therapy of the week, glutathione, the mother and the super antioxidant that's produced in our body, but depletes fast. And we'll talk about that, where it comes from, how it works, how does it benefit you, what's it going to help you with, because that's the main thing you want to know about, right? That's what I want to know about. We love you too. Thank you. We're going to talk about that. We're going to talk about events that we got coming up for Titan, because we got a lot of events, right? We've got also different things. I'm going to cover liver functions. I'm going to cover ALT, AST. What is that? Fatty livers. Why do doctors call it a fatty liver? What's up with that? And then basically man boobs. I've heard this a lot. Man boobs, gynaecomastia, estrogen levels. This is very, very abundant out there, especially if you're working with TRT or HRT. If you're a guy, you might have high estrogen levels or aromatizing estrogen levels, and we'll tell you how to fix that or what's going to happen if you keep up at those levels. For women too, women need estrogen blockers or they might need some estrogen. So it'll cover in both of those areas. And you guys will see, why estrogen, what it does in female body, male body, and kind of how it helps us, right? We want to talk about the protein situation. I brought this up with Drew. Like if somebody tried to take your protein away, what would you do? If somebody said, you can't have any more steak or you can't have any more hamburgers or chicken's going away, you're going to be limited on the stuff you eat. What would you do and how would you substitute those foods? I've asked myself this. I'm like, what would I do? Because I don't know what I would do, honestly. I don't really like too much of this stuff, so I think I would go crazy. What up, Mark? Yeah, man. So, at that point, we're going to go over all that. We're going to cover the Ultimate Health Bible. So, the book that I wrote, the Ultimate Health Bible, so you guys can see it. And me and Jeff Bahar wrote this. It is your guide to anti-aging, fat loss, and disease prevention. Good-looking pictures on back. 2 good-looking guys, but more importantly, it's the information inside. And every week I've been going over a chapter. So I've already started with chapter 1, chapter 2, chapter 3. Today we're at chapter 4. And if you guys want to see or talk about or hear about anything I was talking about in those chapters, you guys can go back to the previous Titan Talks or the podcast. But you can buy a book too on Amazon or Kindle or Barnes & Nobles and get the information that I'm telling you right here as well. Plus, I'm going to start doing the chapters in visual effect. So I actually bring it down for you guys like this on videos and add them up there. So if you buy the book, I'll offer that out to you guys as well. All right, so in chapter 4, it's to properly hydrate your body and why it's necessary to properly hydrate your body and how it affects your skin and what percentage of water is in some of your vital organs like your brain, your kidneys, your liver, and through your blood, right? Because you want to know that. You definitely want to know what's going on there. All right, so Instagram just officially went down on me there. Let me boost it back up right here, and we're going to talk about glutathione here in 1 second. So let me just go live because everybody else just got shammed on Instagram. I was a bad guy on Instagram. I did not charge the iPad. So at that point, everybody that was on there had to get skipped off. So everybody that's on Instagram, please join back up. And we're going to start Titan Talk. Thank you guys for rejoining DC Baker and everybody that's out there. If you guys have not known what's going on in Titan Talk, we're going to talk about glutathione, therapy of the week, how it helps you, what's in it, where does it come from. We're going to talk about Titan events. We're going to talk about liver functions, liver enzymes, fatty livers, why doctors bring that up, gynaecomastia, man boobs, right? What is man boobs, right? Why does gynaecomastia happen to you? We'll talk about that too as well. Also, the Ultimate Health Bible, chapter 4, we're going to cover today, properly hydrating yourself. What percentage of your body, as far as organ-wise, has water in it? Why is it so important to you? Why is it important for your skin, health, development, and life? Because you can't live without water, guys. I don't care if you guys say you don't like it or not. You got to drink it. And you're going to get it from a lot of different things as well. So, without further ado, I think everybody's joining back in from Instagram. I appreciate you guys joining back up. I'm sorry about the problem that just happened. So let's get into Titan Talk. All right, glutathione. Let's talk about glutathione. Glutathione is a super antioxidant. Glutathione, GSH for short, is produced in the liver in your body. What happens to glutathione? Because it's such a great super antioxidant. So why are we just fighting off everything that comes at us, right? Sickness, colds, anything. I mean, you know, you go out drinking the night before, you don't feel good the next day, you're probably dehydrated, your body's obviously lacking nutrients, and you usually go for one of those emergencies, and those emergencies usually have what? Vitamin C is their main thing, right? So at that point, you want to have it because it's an antioxidant to the body, and you don't want your body to oxidize. What happens? So I always break it down to cars. You know oxidation, right? And what happens to a car when it goes through oxidation? For you people that live up north, and then you guys that have snow and salt, if you get it on your chrome and it oxidizes, it rusts and leaves pits. Okay? Same thing happens to the inside of your body. You're going through oxidation. So, how do you combat that? You can combat that with antioxidants, antioxidation. So, which ones are the best ones for you? Glutathione is definitely one of the top antioxidants out there. It beats vitamin C. It also combats a lot of different health ailments or problems that you may have or day-to-day issues. So first of all, we know that it depletes through the body. It's created in the liver, but it depletes. And the reason why it depletes for a number of different reasons. We have toxins in the environment that we're breathing every day. Think about every day that you take a breath outside and how many toxins you don't even know about or chemicals that you're breathing in. And it has maybe nothing to do with what's going on here. It might have happened 10 years ago, still in our environment, chemtrails, all different kinds of things out there. And I could go on conspiracy theories, on and on and on, but let's stick with the facts. So we know there's toxins in our air. We know that we're eating hormones and we might be getting toxins to our food sources. That's another thing that you need to look at is your food source. Breathing in, you're eating it, right? What is another thing that could possibly be happening? Free radicals in the body. Glutathione's great for getting rid of free radicals in the body. So not only boosts the immune system, right? You want to boost that immune function, but you also want to make sure that you're getting rid of free radicals in the body. Another thing glutathione's great is I talked about hangovers or long nights. You go out long nights, you wake up the next day, you got to do something, you got to be at your very best, you might be hurting. And usually these people, they give the IV bags and the hydration, all that. Well, glutathione is definitely going to help you out getting over those bad nights or those long nights. Even if you work in the nightclub industry or a night job per se, and you have to get up real early. You know, your sleep patterns could be getting off. You might not be getting enough sleep, which could lower immune function. So you want to combat that, right? Glutathione is also great for people who have allergies. Now, I didn't get allergies until I moved to Florida in 2001. And really, I didn't really start noticing it till about 2003, 2004. And I'm like, man, I'm getting sinus infections all the time. And the doctor told me it's because I'm getting constant congestion and that's building up to a sinus infection. Glutathione has helped me immensely with my allergies. I can notice getting cleared up in my nose right away, probably about 15, 20 minutes after my injection. It's great for inflammation. It's great for brain power. I mean, it's great for a lot of different things. Let's talk about one of the main things that we use it for here at Titan Medical Center. This is another way it's going to help you. So we're talking about liver enzymes. I brought that up, right? ALT and AST. And you're going to find that in your comprehensive metabolic panel. So if you ever run a blood test, a CMP, through a practitioner, a medical practitioner out there, a primary, or through us, you're always going to be able to see your ALT and AST. And those are your liver enzymes. Those will tell you if your liver is under stress or not. So at that point, you're going to have two different reference ranges, and usually it's 0 to 44 and 0 to 40. So if your numbers come back high, what's going on? Your liver is not processing like it should. It's getting built up with these different things. So things are not working properly or optimally like you want them to. Another thing that happens is when liver enzymes go up. If they go up too high, you can get jaundice and actually turn yellow. I have seen this a lot, okay? Everything you take in orally in your body has to go through your filter in your body. What's your filter? It's your liver. So everything you're processing through there, it's having to process, and it might make it work harder. And if you keep putting orals into your body, and a lot of vitamins are orals. I mean, a lot of medications are oral, and some of these medications really, really damage the liver, especially acetaminophen. You see that a lot, all right? And acetaminophen poisoning, alcohol poisoning, they usually give NAC for that, and you can do glutathione. Along with Lyme disease, it's another great one. Crohn's is another big one. I mean, we've had patients take glutathione for a number of these different things. We're talking about inflammation in the body, right? People always tell me, they're like, listen, I got this inflammation, it really hurts. I'm cracking, squeaking, popping. Rheumatoid arthritis. Glutathione is great for inflammation. It will help take the inflammation down, which should help with arthritis or rheumatoid arthritis. Now, it's not going to cure it, okay? It should just make things better for you. And that's what you're really what you should be looking for. What's going to help quality of life? Guys, I want you guys to keep all your questions. I'm going to answer all these questions because you guys got some good ones here. What up, Big Drew? We got everybody in the house. Victoria Bombshell, I should have ordered glutathione. Got sick for 3 days. Finding this cold, but Titan Complete helped me out a lot too. So Titan Complete's another good one, and it goes along with some of the different things that glutathione can help with too. It just adds on to it. It complements these things. So glutathione is a super antioxidant, and that's what it is. It's usually 200 milligrams per ml, and you can take this every day, every other day. You can use it for a 14-day span straight and double it up once in the morning, once at night, if that's what you're trying to do. It's made for a lot of different purposes, and that's what we're here for. We're here, and our medical staff is here to recommend these things to you. You're supposed to tell us the problem. We're supposed to help you out with the solution. So at that point, you can call us and say, listen, I've been sick or I'm getting sick. What can I do? And we can help you out. I have high liver functions, and we talked about ALT and AST. And when these things go very, very high, or they even double in range. So, and we talked about 0 to 40 and 0 to 44. If these things come back to 90, your general practitioner might be freaking out and want you to go in for a biopsy of your liver. And that's not going to be fun, I promise you. And it might just be some supplement you might be taking orally that's not processing or damaging the liver. At that point, you can always look to injectable vitamins, amino acids, and everything like that. We do it, okay? There's a lot of places out there, but we have niche ones. These are going to be better for higher absorbency, right? And you're going to get higher absorbency, you get a faster transportation rate. The better thing about this too is you're going to get right past the liver. You're going to inject it, so it's going to go right into the bloodstream per se, the muscle in the bloodstream. So you're not having to break down the gastro tract, and you're not going through the liver and bypassing through it. You're not putting damage to it. So you want to make sure you're doing that. You guys straighten things out that you guys can service people. Yes, 707 Psycho, we can help you out. Idaho, nationwide, guys. Call or text 727-389-3220. We can help you out with blood work, hormone replacement therapy for males and females, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, and a lot more. Whether girls want to grow their hair out, their nails, guys want better liver functions, you want better concentration, you want better energy, weight loss, you just want to feel better, quality of life, right? We can help you. So I want to go across that with you guys. All right, I should order the glutathione. Yep, the Titan Complete definitely got it. What is your suggestion of what a man average test should be? Okay, so David brought a good point up, and I get this question a lot, and I see it out there a lot. What's the normal range for a man to be in, right? And when we look at labs, like let's say LabCorp, and that's a usual lab that we use for our patients across the country. It's the exact same reference range. It's 216 to 946. That's a huge range. So we want to look at the age, symptoms, and where you're lining up as your number. Now, when you look at your total testosterone number, don't forget about your free, because your free testosterone is what you're utilizing out of your total testosterone. To answer your question, you want to be at the optimal range of the reference range. So if it's 216 to 946, you want to be at 900, right? If you have to do replacement, have to do an injection or some sort of medication, you want the best optimal result out of it. You don't want to do it to be average. And I'm going to bring this up Friday. I brought some points you guys are kind of going into about not being average, right? and wanted to score higher on tests you should score higher on. And we were talking about the reference range, and I'll bring that up to you Friday. But at that point, you want to be about 900, right? Maybe 1,000. It just depends on the reference range. You know, some doctors freak out if you're over reference range. So be right there. Be at the top. Don't go over. You don't have to go over, but you can be right there, and you should feel a lot better. Make sure your free and your total are both at optimal levels. That should get you there. If you're still having problems with fatigue, tiredness, lethargic, libido, something else, there is another problem possibly. HRT is great. It fixes a lot of different issues, but is not the end-all, be-all, tell-all. There are other things that play important roles in your body that can make you feel different. So at that point, we might need to test vitamin D levels. There might be something going on in prolactin. You could have different things going on. That's why everybody's different and they should be treated that way. It should be custom personalized programs for everybody, not one thing for every person across the board. It shouldn't be cookie cutter. It's your health. It's not that person's health. It's yours. And I've seen this a lot. So guys, look to be at optimal levels if you're going to take replacement, okay? All right. So I need this glutathione. I work night shift and I also have allergies. Dude, I have allergies too, Vic. It is crazy, Victoria. I'm telling you. So glutathione definitely works. Can you take Titan Complete and glutathione? Yes. So she asked a great question that I'll answer. Can you take glutathione, Titan Complete, and Hercules Potion together? Yes, you can. Titan Complete, you can take in the morning. You can take it along with the glutathione. Two totally different injectables. Glutathione is a super antioxidant. Titan Complete, it has MIC, methionine, astatine, choline. It has your B complex, your B vitamins, right? It also has your 3 branched chain amino acids, leucine, isoleucine, and valine, and it also has L-carnitine. So you're getting a lot of different things in there in both of those injectables. So yes, I would definitely recommend it. That's what I take in the morning. It definitely helps me out. I'm around a lot of people. I shake a lot of hands. I talk to a lot of people in close quarters. And I don't like to get sick because, man, I can't stop. Even if I am sick, I got a 10-year-old that needs to get up for school the next morning. I got to come in and work at Titan. I'm working at night. I'm doing social media. I have got to be on my game. And a lot of you guys are the exact same way or want to be that way. So I'm kind of giving you the secrets and the life hacks, right, to do this. It's biohacking pretty much. I see a lot of people throw that word around, and I don't think they really know how to biohack per se. They're just throwing it around, hormones, biohacking. Really do you know how to biohack your body? And you yourself will learn different things about your body that you can do differently than maybe somebody else. I know I have, Shreese has. So look into your body and be in tune to what's going on. Love the book. I give it a 10. Thank you. So somebody has bought the Ultimate Health Bible. Make sure if you do buy the book, you send me a receipt. You're going to get $25 off anything, or you'll get free Titan gear, whatever you guys like. I'm here to help you guys. So at that point, I just want you guys to do it. I need HGH. So let's talk about HGH. Human growth hormone. So that one's a particular one I will bring up. And the reason is because human growth hormone is not prescribed regularly in the United States for adults. It's not made for anti-aging. It's not made for injuries, right? It's not made for any of that. What is it made for? FDA, what do they want this drug to be made for? And what it's made for is made for dwarfism, right? Right? So when kids are real little and they don't have the growth function, that's when they use it for young kids. Now, they have started using it for some adults with adult growth hormone disorder or deficiency. So it has to do with a lot of different testing. Real growth hormone is very expensive. If you see clinics giving it out like candy or everybody's getting it, they really shouldn't. Have you done a baseline for your IGF-1 levels? Do you know how much growth hormone is converting to IGF-1? Because you're getting all the benefits from the IGF-1. That level is really showing you, hey, listen, growth hormone is converting. Your body has this level of IGF-1, so that should help with elasticity. It should help with healing. It should have the anti-aging effect, libido, hair, all these great things. So make sure that you're at least doing the testing beforehand. If some clinic's going to give you just something like human growth hormone, I would definitely say that's a red flag. And if you're younger, big red flag, all right? That's not something you want to get on. The reason it's not something you want to get on, and let me tell you why. Same thing with testosterone. If you're a 20-year-old guy and you're at optimal levels, nothing's going wrong, did a blood test, your levels are great, you're through the roof, why go on to try to suppress things? And when I talk about that, when you introduce exogenous testosterone or growth hormone, it could possibly shut down or suppress your natural function in your body. Now, do you want that? How young are you? Are you ready to go the whole way? And when I tell you that, go the whole way means is if something does go wrong and you suppress or shut down your natural function for good, are you ready to go for the rest of your life to have to replace it and inject yourself? I've been on testosterone replacement therapy for 10 years straight. I do probably about 10 injections a day with insulin needles. Titan Complete, Hercules Potion, Glutathione, my HCG, Thymosin Alpha 1, Epitalon. There's a lot of different things that I'm taking. So I don't mind doing the injections because I'm getting the benefits out of it. But it's not something that I would really, really want to do if I didn't have to. So if my testosterone levels were 1,000 and my free was at, I definitely wouldn't be doing testosterone. It's because my levels were so low and I woke up with the symptoms. It felt like a fog in my mind. I felt like the Walking Dead going through a routine every day. I had little to low energy. I knew I had to do things. So I got up and did it because that's just your heart that's driving you at that point. It's your mind telling you, hey, listen, you're fine. Get up and do it. You've got these other people out there. They're depending on you. So you get up and do it. But you really don't know what that good feeling feels like until replacement kicks in and those numbers goes up and everything's where it should be. And you're in harmonic balance in your body and you're feeling great. So it's a great feeling, man. It's really a good feeling. So the best thing I can say is make sure that you're not overdoing it and you want it. All right, so what should your free be? Your free is going to be, anywhere in between the reference range. So at the reference range, just look at it from the lab. Different labs have different reference ranges and make sure you're at the top. So when you see the test code, I'm going to give you guys a breakdown. If you see the test code right here, it's going to have the number of what it is. And then on the side, you'll have the number, the reference range. Look in the reference range and there you'll see, okay? All right, yes, I'm sold. I'll be putting in my order in glutathione next. I must say I love Titan Complete. Victoria, you're going to like glutathione. Titan Complete's awesome. Hercules Potion is a game changer. If you're usually taking Titan Complete, I always tell people Hercules Potion is like peanut butter and jelly with those two. The reason is because you're getting all those B vitamins, the branched chain amino acids, the MIC, and you're getting that in the morning. And then right before your workout or strenuous activity, you inject the Hercules Potion and you get another wide range of different things that are going to help you through more strenuous workouts or activity, help you with recovery, muscle pump, blood flow, weight loss, liver protection, all in there. So at that point, you got that with the Hercules Potion. So combining those two are awesome. If you did do all three, I call it the trifecta. You guys might see that in the post on Facebook and the stories. They definitely work in different functions and help you in different ways. And all those injectables can last 1 to 2 months, right? Just depending on how you inject them and what's going on with your regimen. But they are effective in a number of different ways and will definitely help you out. So I think we covered glutathione pretty good. We covered liver functions, fatty liver. So how do you get a fatty liver, right? Doctor said, hey, Joe, you got a fatty liver. Well, doc, what does that mean? That means your liver's fatty. Well, why is it fatty? There's a number of different reasons why. Usually it's because of fatty foods, and that's what they say. And then you tell them, my diet's clean. I don't eat no fatty foods. Well, it could be a number of different things. It could be the supplementation that you're taking in. It could be acetaminophen. If you're taking a lot of acetaminophen, that could definitely affect the ALT-AST. But if those things are high and you don't know what's going on, if you're taking oral supplementation, exit out. Take one thing away and you should test. I know it's harder to do these blood tests, but definitely do it every 30 to 60 days until you dial yourself in or you know what's going on. Even with the glutathione, we like to do 14 days, 30 days, then retest your CMP, see it trending down or in with range. Usually 1 month of glutathione treatments will usually bring liver functions back into range, depending. Now, if you have hepatitis C or something that's affecting the liver like that, it might not do as much, right? Because you have these different things going on that could differently affect it, like we talked about, like hepatitis C. I always tell people that, so make sure that you know what's going on. All right, man boobs, gynaecomastia. That's what it is. Gyno on the streets. Woo! All right, so I see a lot of these different things. I see a lot of different things going around about AIs or aromatase inhibitors, estrogen blockers. They shouldn't be used. Why they shouldn't be used? They should be used. What's going on? So let's talk about it a little bit. Estrogen. So we know estrogen fuels tissue growth. And, with estrogen, high estrogen levels, we know that, it can create tissue in the chest area. For guys, it can create the exact same effect where it creates a boob-like because it creates more tissue underneath. And when guys flex, it usually goes in or usually just pops out and it looks like a boob. That's why they call it man boobs, right? Well, girls the same way. They have high estrogen levels. Their estrogen, their fat deposits go into their chest, right? And that's where they get their chest from, and the thighs and the glutes. So that's where it packs on the most, and that's where girls usually get it for the functions. Guys the same way. They'll get the love handles, right, in the stomach area, and they can't get rid of it, and they don't know why. My testosterone's low. I might have high estrogen levels. What's going on? So always keep track of your estrogen. Now, E2, especially for guys, that's estradiol. Now, there's two different tests that test estradiol. There's estradiol and estradiol sensitive. I know out there, estradiol sensitive is being pushed a lot and saying, it's more accurate, Guys, I've ran estradiol and estradiol sensitive together in the same test with me and other patients, and the exact same number came back. I mean, to a T, and that shouldn't be happening. I don't know why. One should be more in tune than the other one, I would think, right? So don't get caught up on that, but definitely check on the E2. Now, different levels of E2. So E2, on the reference ranges, it could be from 70 to 42, like LabCorp. And where should you be at? So a good number for you to be at is when you're non-symptomatic. When your estrogen's too low, it's a bad thing. When your estrogen's too high, it's a bad thing. You don't want to be too low because it could dry you out. Joints ache, muscles ache, sore, you don't know what's going on. That could be an issue. If it's too high, things like water retention, irritability, possible gynaecomastia, if it stays like that, can happen. Now, I heard some guys say, well, your testosterone should be at this, and your estrogen, just because it's high, it's at this ratio. And that's why it's high. There is no ratios, guys. I don't know where this calculator and all these things came out with, stuff like that, but doctors don't look at it like that. So maybe some do. I'm not going to say that, but I know the majority of the doctors that I've dealt with, and I've dealt with quite a few in this business, never look at a ratio and a calculator. They usually look at what the reference ranges are. They listen to the patient about the symptoms and where they're at and how they're feeling, and that will usually determine what's going to go on with the regimen. Now, if it's too high and it's a 42 and you're like, well, I don't feel too bad and stuff like that, it's still not good. We should still get it down within range, right? Maybe it's a 30 that you're good at. Me, between 10 and 20 is usually good for me, and that's what most of the patients here are usually at. Some are a little bit better at 25 and stuff like that. Now, if they feel like that, that's great. Some people need more estrogen blockers, aromatase inhibitors than others. And it just is what it is. Some females need it too, right? So Charisse is a prime example. Endometriosis fueled by estrogen. When they did the biopsy on it, it was estrogen positive. We knew that estrogen, high estrogen levels, fueled the growth of endometriosis. And somebody was trying to have me explain to them, what is endometriosis like? What does it look like inside? The best way I can explain it to you guys, if you guys are comic book people, is think of venom. Think of that symbiote, right? That little black oil stuff that shoots out and gets on things and sticks together. That is like endometriosis inside the body. You got ovaries, and you got organs, you got all things, and stick. It's like scar tissue, and it gets real tight, and it starts causing pain and hurting inside, females. So it's another thing you guys got to look to. Estrogen can be very, very bad. You do need some estrogen in your body, males and females, just at different ranges, all right? And for females, you want to test total estrogens. There's a couple of different tests for estrogens because you guys, we have to look, or you females, we have to look at it a little bit more. So that's what it is. Guys, always make sure you're getting your prescriptions from real U.S. licensed pharmacies. I'm going to tell you a story because it's pretty funny. So I've been in this business for 7 years. I've seen some crazy, crazy things. Now, if you're getting your medication from a clinic, it shouldn't say on the bottle the clinic's name and their address, right? You never will get that from Titan Medical Center. It might say Hercules Potion. That's what the pharmacy named it with us. But it comes from the pharmacy. It has a pharmacy's name, their address. If something goes wrong, contact them, such and such. And that's what you really want to do. And you really, really want to watch out for this. So over the weekend, and I'll fill you guys in on this. I wasn't going to mention this, but I might as well. I watched a documentary on Netflix. I seen it. It was Screwball. I'm like, all right, what's this about? It's about Bosch, right? And Bosch was the supposed doctor that helped out A-Rod, if you guys know baseball, with steroids and Manny Ramirez and getting these guys juiced up and such. So he's on there and he's telling the story. It's Biogenesis down here in South Florida is where he opened up. His dad was a licensed physician here in the state of Florida. Where did he go to med school? He was saying he was a doctor, Dr. Tony Bosch. He went to med school in Belize. Well, Belize, the med school, it's not over here. You can't get a medical license. So he wasn't a real medical doctor, but he opened a HRT clinic. That'd be just like me opening an HRT clinic, and then fronting himself as a doctor and getting big clientele like A-Rod, Manny Ramirez, all these baseball players, all these high elite, all these different people thinking he was a doctor. Wasn't a doctor, had his little medical certificate from Belize up there, so people thought he was a medical doctor because he went to Belize Medical School. Not the case. Here was the big thing that I seen. I was like, I cannot believe that this went on for so long. So when these patients were getting their prescriptions, they weren't getting from U.S. licensed pharmacies either. He was going through an underground steroid dealer to buy the testosterone to ship it to patients. I've seen this like not too long ago going around in the state of Florida again, which is very concerning to me and concerning to a lot of other people that are in our business. Pharmacies, doctors, it gives our business a black eye. And when I seen this on Netflix and I watched Screwball, I recommend you guys, because it was funny. I ain't gonna lie. It was definitely funny because it had the real people talking, and then the playback, like, you know, the dramatization of these people. It was kids. And these kids, like, it was like, I don't know, like the Lion King, the new Lion King. These guys' mouths were running, but it wasn't them really talking. It was great documentary. You guys will get a kick out of it. Learn a little bit something about my business and what went on. So it was crazy. And to think about what Major League Baseball did and stuff like that, it's crazy. Oh yeah, Pat Russo. If you guys didn't see this video, Pat was on there today. My man from PA came down to visit me, good friend and everything like that. All right, Victoria, where do I inject Hercules Potion when I train glutes, and how much do I inject? Okay, Victoria. So this can be done a number of different ways. So you can inject Hercules Potion in the deltoid, right? You can inject it right in the center of the deltoid, or you can inject it in any muscle you want. So it can be bicep, tricep, whatever it means. So injecting in the delt is usually for the amateurs or somebody like who doesn't really inject that much. They don't want to get crazy. They just want to do it and that's it. They can do it here. It's going to work systemically through the body. So it's going to work no matter where you inject it, right? You're going to get all the great benefits from Hercules Potion. Now, if you inject in that muscle that you're going to train that day, you're going to get more of an instant gratification. So a lot of girls I know, Victoria, they inject in their glutes and they want to plump the rump. That's what we call it here. And it's either before shows or before they go into pools or before they see their boyfriend or whatever it may be. But they use it in a different way. If you got questions on how to inject Hercules Potion, you're a patient, please call here. If you guys are patients, you guys have us. So please call us, contact us. We will get back to you. And if somebody doesn't, you contact me personally and I will make sure I get back to you or somebody will get back to you immediately. But it's usually 1 ml. For some people, I've got some other different people. They might do a little bit more, might do a little bit less. It just all depends. But usually it's 1 ml. And you usually do that in the muscle you're injecting. You're going to work out that day. All right? All right. So that's that. We cover the hydration, the meat. All right. So the last thing, I want to go over the events. So this last week, we had 2 great events. We had one was Specialty Fit. That was in Pinellas, here local, and it was great. It was for disabled, it was not for disabled, excuse me, for special need athletes, right? And for these special need athletes, they got to compete for money. They didn't win a trophy or an award or anything like that. They actually got to win money. And some of these athletes that came out there, I didn't get to go out there personally. I was really upset about it. But my team was out there. I got to see some of these athletes really, really perform. And they were just amazing. And I love Titan being a part of something like that. It helps, it gives back, and it gives these guys hope and more belief in what they can do. Because don't let anybody tell you you can't do anything. You can do it. Trust me, I've seen people with disabilities do a hell of a lot more with people that have everything given to them, all right? It's because they got the heart and they got the drive and they're willing to go all the way. So I got to give it up to those guys. Saturday was awesome. I can't wait. Hopefully we're part of it next year. Specialty Fit, Specialty Foundation. Thank you, Mike Olivia. All right, so at that point, the next thing was PCA USA. So went out Sunday. Titan crew was out there. Family was out there. We had some of our athletes like Chrissy. She was at the show performing on the stage. Great man Ian Harrison put it on. Jeff Culp's one of my athletes. He was basically judging. It was awesome. You know, everybody's there. Everybody's having a good time. It was really there for the athletes. We were there in Sanford. Can't say too much about Sanford, but it was a nice theater. I'll give them that. But we were there, much support, a lot of great athletes, a lot of giving back. Those athletes got to win some money too. So they're amateur athletes going on stage for the first time, some of them more seasoned, but they got to win money. So we were there, full support, especially fit on Saturday, PCA USA in Sanford on Sunday. This upcoming weekend, we've got the Florida State Classic. Deke Warner and Titan Medical Center present. We cannot wait to be out there. It will be Saturday, right? And it's in Okopoka, the Florida State. It's at Olympia High School. It's about 15 minutes away from International Drive. I know because I'm staying at International Drive Friday night because Saturday I will be there at that event representing with the Titan crew, giving away Titan gear, free Titan tank tops for you ladies, shirts for you guys, those special Titan Strong. No other alternative shirts will be on hand. We'll have a lot of leggings, a lot of different things out there. I'll be out there. Drew will be out there. We'll have IFBB Pro Jen McHenry out there, Stacey Masita, and maybe a couple other special guests. So come out there, visit us, take some pictures with us. I'll probably be at the night show, maybe a little bit during the day. I can't wait. It's going to be awesome. Deke always puts on great shows. It's going to be great, guys. So I'm looking forward to that. After that, we've got the Iron Bay Classic coming up. Man, Jose Santiago and Santran. Titan Medical Center is the full sponsor and title sponsor of that. And we're going to be throwing out shirts there. We're going to have Titan there on hand. Hero Class National Qualifier this weekend for Deeks and for the Iron Bay Classic. So I'm excited about that. We've got St. Pete Fashion Week coming up. See, Titan does more things. We do Fashion Week too. So we're excited about that. The whole weekend. Donna Crawley, we always work with on that. It's local here. If you guys want to come out, let me know. It's a whole weekend event. I can't wait. Really excited. Last year we were title sponsors. We had an awesome time. So looking forward to that. Daytona Classic we got coming up. We've got a lot of different things. Keep it locked to the newsletter. That's the best way because we're doing this newsletter, pumping out some great content to you guys, letting you guys know exactly what's going on, therapy of the week, other different things too. So text 22828, right? You're going to text Titan Medical. So all you have to text is the number 22828, and you're going to text Titan Medical to that number, all right? And you'll be locked in for the newsletter. So I want to give away a $100 gift certificate as well. The $100 gift certificate I'm going to do at the end. You're going to hashtag Titan Gift, and you're going to text it to 727-389-3220. I'll also give away one piece of Titan gear, whether it be leggings, shirt, whatever it may be. Hashtag Titan Gear. You're going to text that to 727-389-3220. Do that at the end because we're going to talk about one more thing. So we want to talk about our poll question. Our poll question of the week. Have you ever tried an amino acid or vitamin injectable specially formulated by us, Titan Medical Center? So have you ever tried a vitamin amino acid injectable that Titan Medical Center has? Like one of our niche ones, Hercules Potion, Titan Complete, Titan Ultra, Serenity. We've got a couple other ones, Titan Up, Super Titan. So what we see on here is majority of people said yes, right? We did have majority of people say yes, but we had almost that number say no. Can I have some more information? So for those people, if you did hit that questionnaire, we can send you out some information on this and tell you a little bit about what we have to offer. But our vitamin amino acid injectable therapies are really, really awesome. They're niche. They're formulated for our patients only. That means you can only get some of these vitamin amino acid injectables through Titan Medical Center. And they're going to offer you a wide range of different benefits from better concentration, more strenuous activity, liver protection, getting your vitamins like for energy, B vitamins. You're going to be able to get your branched chain amino acids to help you along through the day. Make sure your muscles don't get cannibalized. Make sure you're growing the muscle. Plus, we know amino acids are building blocks of protein, right? They're going to help muscle building, lean muscle building. We're going to do a lot of different things as far as for sleep. So if you're looking to get any of these different things, you're going to definitely want to look into our vitamin amino acid injectable therapies. If you want more information about them, call or text 727-389-3220. And I think that's it. I think we pretty much covered everything. 44 minutes. Usually I do 30, so I went over about 14, 15 minutes. I appreciate you guys tuning in and listening to me talking for this long. If there's any other questions you guys have, shoot it to me real quick. Victoria, thank you. And Victoria, let me know. I'm going to send you out a free pair of leggings too. You've been very interactive. I appreciate people being interactive with me. So if you call or text Text the number 727-389-3220. Let me know your size of short Victoria shirt, tank top, and I'll also send out a pair of leggings for you too. I love giving back to my patients or people that are tuning in, trying to get educated, trying to be informed, and using this information. That's why I'm here. I'm here to inform you guys and give you guys a little peek behind the curtain of what really goes on and how you guys can get better health and get better medical treatment. Because God knows you deserve it. We pay enough for it. So take advantage of it, all right? I appreciate everything, guys. If you have any more questions, concerns, want to sign up to be a patient, you guys can call, text 727-389-3220. If you guys want to learn more about some more vitamin amino acid injectable therapies, glutathione like I talked about today, you want to know how to inject some of these things, you want to know some more information about Titan Medical Center, some of the fun things we've done, check out our YouTube. Go there, Titan Medical Center. All of our videos are there, Hercules Potion, Titan Complete, Glutathione, and a lot more. Please keep it locked to Facebook and Instagram. I appreciate you guys tuning in again. Thank you very much for another successful Titan Talk Tuesday. I'm John. I appreciate it, and I'm out.